The Gauteng Health Department says it's studying a High Court in Johannesburg ruling which ordered that pregnant migrant mothers, as well as their young children, are entitled to free health care at state hospitals. It is irrespective of their status in the country. That means whether they're here legally or not. Let's speak now to the acting South African Medical Association chairperson, Professor Ames Dhai. Prof, very good evening to you. Grateful for your time. Can I get your reaction first as an association to what the court has now ordered?
So good evening to you and to your listeners. I think it's important that all women that are pregnant and lactating and children under 6 are given free health care. And I think we need to live by that. What we have is, it's a constitutional right, together with the fact that it's been enacted into the National Health Act. However, as usual, we pay lip service to those rights. So yes, it is important that where the woman can't afford, for example, they do not have medical aid, then they should be given that free, but not just free health care, but quality health care to go with it.
But the issue of public health care services being provided to migrants, asylum seekers in South Africa, as you know, has been quite contentious. People saying that it's putting pressure on an already stretched public service, and some feel it's unfair. I remember there was a conversation last year, I think it was in Limpopo, where the MEC had even suggested invoicing countries such as Zimbabwe for services given to their citizens who get medical care in South Africa. What is the right way to proceed on this?
So the right way to proceed on this is to have your ducks in a row. And the state should have been proactive in this regard. I totally agree that it's not possible given our shrinking economy and the poor health services that we have. No excuse, but we are in a situation with poor health care services that we cannot manage to extend ourselves further. However, there ought to have been, much earlier than the situation arose, agreements between the countries, for example, the SADC countries and South Africa, to ensure that any citizen of those countries that were here either as asylum seekers or undocumented migrants, etc., there ought to have been MOUs in place for the health department to actually charge for these, invoice this health care to the relevant countries. And if we have our ducks in a row and we have proper management, it's not going to be difficult. We can sit back and say, but it's going to be difficult now. And that's because we have inefficient management. We're riddled in corruption, as we all aware. We've seen how things have unfolded from the time of COVID-19 and even before. And we know what's happened during the time of the Zondo Commission. And, we need to put these things right. One of the important things would be to go digital, to ensure that there's a central database that actually captures situations, all situations, including situations like this, and then to bill accordingly.
And it really isn't.
While the foreign citizens are in our country,
right, and
they need health care, we must give them that health care.
And it really is a decision.
It's inhumane to turn them away.
Right. What I was trying to say, Professor, is that it really is basically a choice between saving a life or leaving someone to die, right? Because in 2 of the cases quoted in the court papers, one was of a little boy who'd ingested rat poison. He was refused treatment, we're hearing, at the Charlotte Hospital unless a payment was made of 5,000 rand or they were able to produce a birth certificate. In the other case, and a woman who was 8 months pregnant was refused treatment for high blood pressure unless a payment of 20,000 rand had been made.
That is the lowest, our healthcare facilities for performing in this way have stooped to the lowest forms of medical ethics you can. It's unimaginable, it's unconscionable that patients die because of the 5,000 rands and the 20,000 rands. And I would like each and every state member to ask himself or herself, if me or my family was in this situation in another country, would I like this to happen to me? And if the answer is no, then it should be no for these patients as well. It's just so sad that the patients are stopped at the level of admin. Because if the patients get to a healthcare practitioner, the healthcare practitioner will look at that patient as a patient and not as a foreign national, and therefore will do the necessary emergency care possible.
Professor Ames Dhai, good to speak to you from the Medical Association here in South Africa. Just in the case of the pregnant woman, it was her child who died as a result of her being denied health care for high blood pressure. Thank you so much for speaking to us tonight, Professor.